The 9 patients, according to Public Relations Officer of the Ministry of Public Health, Terence Ezibum, were moved to the former Ocean View Hotel on Monday. They were previously tested negative for COVID-19 and are awaiting the results of a subsequent test, which would medically clear them of having the virus. The PRO said despite the fact that the building is still undergoing extensive construction, the 9 patients which were recently transferred to the facility have all the necessary amenities in place. When questioned on the reasons for the move from the Diamond Isolation Facility, Ezibum told this newscast that he does not know and advised that we seek that information from the Diamond Medical Facility. Efforts to contact Deputy Chief Medical Officer Dr. Karen Gordon-Boyle, Minister of Health Walter Lawrence, Dr. Leston Payne, Deputy Director of Health and Emergency Operations Center, and other members of the COVID-19 task force proved futile. At the weekend, a shocking video of doctors kicking down a door of a room at the isolation unit at the Diamond Diagnostics Center emerged on social media. Nightly News understands that a patient who was retested negative at the facility objected to having a new patient who tested positive for COVID-19 share a room with him. He consequently barricaded the room, which prompted the doctors to attempt to forcefully gain entry. It is unclear whether the move of the patients is in response to this incident. Meanwhile, after registering 12 new cases in the last 4 days, as of Wednesday, no new COVID-19 cases were detected. The case count still remains at 139. Deaths remain at 11. Chief Medical Officer Dr. Shamdir Prasad revealed during the COVID-19 live update that 5 additional persons have recovered. The total recoveries is 67.
To date, the total number of persons tested is 1,500, with a total number of negative cases being 1,361. 61 active cases in institutional isolation, 2 patients in the COVID ICU, and 8 persons in institutional quarantine.
Pointing to the persistent lax behavior by some Guyanese, the chief medical officer said that Guyana is behind other member states who are beginning to see the light at the end of the tunnel.
Is this callous attitude going to persist until Guyana is swarmed with a high number of deaths? 1 death is already too many, and we have 11. Please note that our sister CARICOM countries have begun to see a decline in their numbers, yet we have an almost runaway situation. Our efforts in limiting the spread of this disease are dependent on all of us if we do not want to end up, as the PAHO model indicates, with an exponential rise in positive cases and deaths that will overwhelm our healthcare system. We have recorded positive cases at the Palms Geriatric Home, so the ministry is working closely with the authorities there to ensure that our elderly are safe.
Temika Rodney reporting for the HGP Nightly News.